Sudden cardiac arrest is abrupt and often shocking and can happen in the young even with apparently healthy hearts. Many people do confuse between heart attacks and sudden cardiac arrest. Now, heart attacks happen when there is block in the blood vessels that supply the heart, and heart attack is one important cause for sudden cardiac arrest. On the other hand, sudden cardiac arrest happens when the heart completely comes to a standstill and it doesn't pump blood anymore. A rising prevalence in sudden cardiac deaths in the young is very alarming. And having said that, almost more than 50% of the young people who sustain sudden cardiac arrest, they do so even without a warning symptom. So then the next question arises. So if there are no warning symptoms, how do we even identify if we are at risk for getting heart diseases or an acute cardiac event? As we all know, cardiovascular diseases are mostly lifestyle related diseases. So the most important thing that we need to do is have a healthy diet, follow a very good lifestyle, try to do physical activity for at least 1 hour, at least 5 days a week, and then stop smoking if you're doing it, stop alcohol. And if you have any risk factors like diabetes, high blood pressures, cholesterol, high uric acid, yes, definitely you need to keep all these risk factors under good control. Now, apart from this, there is one important cause that I need to tell you. Now, if there is a family history of heart disease or stroke or sudden deaths, then it is important that you realize that you are at an increased risk of getting a heart disease. So it's important to identify if you fall under any of these risk factors and go discuss with your cardiologist and get your heart screened.